This is a recording for the Occupational English Test held at MedCity International Academy on 16 December 2023. The candidate's name is Pallavi Vivekananda Malekar and the candidate number is 33456. The interlocutor is Sangeeta Gopi and the interlocutor number is 18432. This will be role play number 1 for the profession of nursing. Good afternoon.
Good afternoon, ma'am.
May I see your ID, please?
Yes, here it is.
Okay. Thanks, Pallavi.
Thank you.
So Pallavi, remember, this is a test of your English language and not an assessment of your professional knowledge.
Yes.
Keeping that in mind, speak as you would naturally in any situation. Now, we will move on to the warm-up session. I will be asking you a series of warm-up questions. This is not in any way assessed, and this is just so that the two of us get familiar with each other's voices. Okay?
Yes.
Right. So, your first question is, why are you taking up OET?
Yes. It is because I want to work in UK. So, to go further with that, I have to give an exam, that is Occupational English Test, and so that's why I have here to give OET.
All right. And what qualities of a nurse do you have?
Actually, a nurse should have many qualities, but what I have is I can understand the situations, and understanding is a main thing what the nurse should have.
Okay.
Because she should understand the situations and the patient, what he's going through, and the keen observation also. The nurse should be a keen observer so that she can understand, she understands the situation.
All right. And what helped you decide to become a nurse?
It is because of my mother and my grandmother, because they are both in this profession, and I have grown up seeing them too. And because of that, it made me curious in that times that they were doing the shift work, and I was gaining all the information they were giving me and all the experience they were having. So I also ended up doing the same.
Okay, that's nice. All right, we are moving ahead. Now we will go on to the role play card. You will have 3 minutes to prepare on the card. You may make notes on the card if you wish to do so. At the end of the 3 minutes, you will be given 5 minutes to enact the role card.
Okay.
Do you have any questions?
No.
Okay. So here is your role play card and this is your pencil.
Yes.
Your 3 minutes preparation time starts now.
How can I address you, ma'am?
Oh, okay. 1 second. 35 years. You can call me Sangeeta itself.
Okay.
All right, Pallavi, that's the end of your preparation time.
Yes.
We will now start the role play card. Remember, you have 5 minutes to enact the role card.
Yes.
Don't worry if I stop you. That would just mean that's the end of your time.
Yes.
Are you ready?
Yes, ma'am.
Okay. So your time starts now.
So, hello, Sangeeta.
Hi.
Can I know the reason behind why you called me? As
Oh,
you
right,
requested
right.
me.
Yes, yes, yes. I wanted to see someone because I have these questions in mind. Um, Something regarding the discharge. I thought I would be discharged today, but I
Yes.
don't seem to, have any news so far regarding the discharge. So I'm a little worried about that. Can you please update me on that?
Yes, I would like to update you on that. As you were scheduled for discharge today, but as you are having a fever, so because of that, the doctor wants you to monitor the vitals, that is the temperature. So he wants to monitor because it can be a sign of infection.
Okay, wait. But I thought the operation was done 2 days ago.
Yes.
And I don't have any kind of pain. So I thought, the doctor initially told me I can go home in 2 days' time. See, I have a 6-year-old child, and
Okay.
because it's just 2 days, I've made arrangements with a relative of mine to take care of the child for just 2 days. But
Okay.
I mean, if I don't get discharged today, there's no one to look after her tomorrow.
Oh, I completely sense your feelings over here and your concerns about your daughter. We will see what we can do to help you with that.
Okay.
So, before going further with that, can you tell me how are you feeling after the operation? Is the pain well controlled?
Yeah, thankfully. I was expecting a lot of pain, but no, it wasn't that bad.
Okay.
And to be honest, at the moment, I don't feel any pain at all.
No, it's good to hear that. And are there any other concerns regarding the operation?
Yeah, and not regarding the operation, you just mentioned that this fever could be a sign of infection, and that is really worrying me. I mean, does that mean the operation was not successful?
No, it's not like that. And the operation was successful. But as you're having a fever, and sometimes it can be infections. But it is very common after the operation. But sometimes it can be infectious, and sometimes it is not. So the doctor, to check it, the doctor has ordered some blood investigations to see whether you're having an infection or not.
All right. So, see, like I told you, I've made an arrangement with my
Yes.
relative for my daughter. I'm not sure if that person will be available for tomorrow. So, can I do something like? Can I maybe go back home and then come back for the test that you've just told me to get?
It's a really good idea from your side, but in this moment we can't consider that because after operation we have to check whether the signs of infection is there or not.
Okay.
So the doctor, as I told you, the doctors have ordered some blood investigations. So if the result comes normal and you are not having any, so you can go home with the
Okay.
doctor's permission. He'll
Okay.
recommend you to go home, but we want you to go home with a really good health. I hope you're getting my point.
Right,
away.
I totally understand
Yes.
that, and I respect all that you've said, but my major cause of worry is my child.
Yes.
I mean, she's all alone and I'm a single parent.
Yes.
And initially I did have this discussion with the doctor, and that's when he told me that it's just going to be 2 days,
Okay.
which is why I've made arrangements only for the 2 days. Now, I mean, I have to go home. I don't think there's anything else
Yes, I
can do.
completely sense your feeling as a mother. You must be worried about your
Yes,
child.
of course.
But we'll do something to help you out with that.
Okay.
But initially, we want to make you medically stable.
Okay.
So if you're medically good in your health, then only you will be able to take care of your child.
Yes, I understand that. So, can I ask you something? Like you said,
Yes.
you would make some arrangements for me to, get this thing all ready with my
Yes.
daughter, somebody to look after my
Yes,
daughter.
yes.
So, could you please speak a little more about that? What can be
Yes.
done?
Yes, I'll tell you about it. Actually, we can schedule a visit by a social worker to check with your doctor.
Okay.
So we can make that arrangement for you, and you can also get better over here, and we will check all the reports. And if it is normal, then we'll consider your discharge.
Okay, so the social worker that you've just mentioned, do you think that person will be able to go and meet my, my daughter now, so that
Yes.
I get an update as to what arrangements can be made, and if things are going to be fine, then yes, I don't mind staying back in the hospital.
Yes,
But can you get me this confirmation?
Yes, absolutely. The social worker will be going to your home, and he'll be checking the difficulties what he's going through.
Okay.
So we are giving you the confirmation that he will be going and seeing your daughter.
Mm-hmm. Okay, all right.
So are you all right staying back in the hospital then?
Yes, if I get a confirmation, then I wouldn't mind.
Okay, thank you.
Okay, thank you. Yeah, that's the end of your time. Thank you.
Thank you.
MedCity International Academy. Trusted hands forever.